Akonde. Well, let's now turn to the health sector. The World Health Organization says it has conducted a risk assessment which found that the new EG.5 variant poses low risk at a global level. But the Nigerian Center for Disease Control and Prevention still insists that it will continue to monitor situations around the globe, especially in countries where the new subvariants of the Omicron variant of the Sarscov-2 virus have been confirmed. This comes on the heels of the discovery of new variants named EG.5 and BA.2.86, which are descendants of the SBB.192 of the Omicron variant. And health correspondent Kemi Balogun has more details.
The new variant EG.5 has already been recorded across 51 countries like the United States, China, Japan, Australia, Spain, and others. It has been classified as a variant of interest by the World Health Organization. So far, only one case of the EG.5 has been seen in Africa and has not yet been identified in Nigeria. The EG.5 variant causes symptoms like those seen with other COVID-19 variants, including fever, cough, shortness of breath, fatigue, muscle aches, headache, and sore throat. All viruses, including the virus that causes COVID-19, change over time. These viruses that change are called variants. These changes can affect how contagious a virus is, how well it responds to treatment, and how severely it affects people. The recently discovered BA.2.86 is a descendant lineage of the BA.2, a sublineage of Omicron, also found in Nigeria in 2022. Recent data shows that 9 cases of the BA.2.86 variant sequences have been reported globally. According to findings by the US CDC, existing tests used to detect and medications used to treat COVID-19 appear to be effective with this variant.
Proud of the COVID-19 vaccination levels that we have achieved. If you look at the data,
the BA.2.86 may be more capable of causing infection in people who have previously had COVID-19 or who have received COVID-19 vaccines. It is too soon to know if this variant might cause more severe illness compared with previous variants, especially with only 9 cases so far detected. It is also too soon to know how transmissible this variant is. The NCDC still advises the elderly, those with underlying chronic illnesses, especially hypertension, diabetes, those on cancer treatment, organ transplant recipients, and those whose immune systems are suppressed to consistently take extra precautions and observe all preventive protocols. Kemi Balogun, TVC News, Abuja.
Now, the head risk communication, NCDC, joins us live to give further perspective on the monitoring of the new COVID variant. Good to have you join us. I'm Yahaya Disu.
Good evening. Thank you for having me.
Good evening. We understand that this particular variant carries about 35 mutations. And so people are wondering, with that kind of information, what is the risk level? And then what is also our surveillance level as a country?
Oh, well, you're just correct that it has various mutations, as in a lot of different from the ancestors. But because we still have few cases, we don't know much about the symptoms, the virulence, and then probably the severity. But we need to be on the caution side for us to, because things can turn around at any time. So that is why we need to ensure that we get vaccinated, because that's still the best way to protect ourselves, and especially those who are high risk, the elderly and those who have hypertension, diabetes, chronic illnesses, and should also make sure that they take precautions based on the risk assessment, and then where you know that people may be having flus, symptoms, cough, and so on. Then you need to wear your face mask in that situation and make sure that you maintain some distance to limit the possibility of getting infected. We continue to monitor this, and the genomic sequencing we do in Nigeria has not shown the evidence of having this in country. Our influenza surveillance that we are doing currently, we also take sample to test COVID-19 and to do genomic sequencing. We have not identified that in country so far, but efforts are ongoing to ramp up testing and to also encourage people to report. But that's the only way we can actually pick these cases. When people show signs and symptoms that are similar to what we look like COVID-19.
But let me ask you, because for some people already have taken the vaccine, and you have talked about vaccination also being, the most preventive measure. But what does this mean for those, for prior vaccination and then for booster doses that some people are also looking to take?
Well, evidence has also shown that the more doses people take, the more likely they will be protected. Well, however, there is minimum doses recommended. Just like when the vaccines first came, 2 doses were recommended. Then later, because of new cases we are having across the globe, then booster doses were also recommended. So I think if you have not taken the 2 doses, and then this is the time for you to make sure that you go back and take the doses, take the vaccine. And then those who are
just to quickly come in, Mr. Disu, are we saying that, look, this particular the prior vaccination is still very effective against this particular variant?
Well, because we don't have many cases, it is difficult to conclude whether vaccines are not effective against it. But so far, the information we have, people who are vaccinated against all variants are less likely to be affected or to have severe infection from the past COVID-19 infection. So that is the bullet that we have in our hand now that we can use to kill this enemy.
All right, thank you so much for talking to us. We will continue to communicate with you as we witness more development around this particular variant. The head risk communication, the NCDC, Yahaya Disu, thank you so much for talking to us.
Okay.